What if a routine preventative scan, one that you choose out of curiosity, not fear, changed everything? Not just your health, but the way you show up for your family, your work, and yourself. I know so many of you listening have navigated a health journey, whether it's your own diagnosis, a loved one's, or just that nagging feeling that something needs to change before something forces you to. This episode is for you. Here's the reframe. Your body doesn't wait for a convenient time to get your attention, but how you respond, the habits you build, the mindset you bring, the way you take back even a small sense of control, that part is yours. And that's exactly what this podcast is about. Today, I have my most personal guest yet, my husband, Jimmy Sederberg. Jimmy is a cardiac anesthesiologist here in Denver, and in May of 2023, a routine calcium scan turned into the discovery of a rare thymic carcinoid tumor. What followed was two surgeries, radiation, ongoing surveillance, and a complete reorientation of how he thinks about his health, his time, and what matters most. In this conversation, we talk about what it really is like to be a healthcare professional on the other side of a scary diagnosis, how his daily habits have shifted, what scan anxiety actually feels like from the inside, and what he'd say to anyone who has been handed news that they weren't expecting. What I love about this conversation is that it's honest, it's real, and it happened over coffee, just like we do most every weekend. Let's get into it. Welcome back to the Harness Your Health podcast. I have a very special guest here with us today, my husband, Jimmy Sederberg, and we are going to talk about lots of juicy topics. But first of all, I just want to thank you for being here. And I have to say, this might have been one of the harder podcasts to schedule, if you will, which is random since we're both in the same house right now with kids and dogs present. So hopefully it'll all go as planned.
Thank you for having me. I've been a great admirer for a long time of your work.
So I started this podcast, I think I'm about 8 episodes in, and have definitely done some really great interviews. And just in the process of talking about the podcast and sharing things with you, you mentioned that you would be a guest on my podcast. You also work in healthcare, and we're going to talk about that. But there's something important, I think, and maybe a message that we want to talk about. So we'll get into that in a little bit. And I should just say, we have a tradition on the weekends when you're home that we do coffee. So we're doing our coffee. We're enjoying our coffee together, just in a very different way than we normally do.
Yeah, absolutely.
So you grew up in Denver. You're the oldest of 6 kids. Do you want to just talk about that a little bit? Was it a little bit crazy or?
Sure. It's the only way that I ever knew, so I didn't know anything but the craziness. I am 16 years older than my youngest sister, so I had a lot of practice changing diapers, kind of helping raise kids. The big deal was that my sister was born a few months before I got my driver's license, so as soon as I got my driver's license, my parents were very happy because I was able to run a lot of errands, drive carpool. Luckily, there weren't the rules there were now, so I just kind of jumped in and was able to help out. But yeah, it's great. We didn't always all get along, but now that we're all older, we get along a lot better. And when we see each other, it's really neat. And seeing our kids together too is really cool.
Yeah. And it's pretty special that all of your siblings live in Colorado, within an hour or so of Denver.
Yeah, that wasn't by accident. My parents worked hard to make sure that happened. They
Yes, your
wanted it.
mom,
This was
for
their
sure.
goal, was to have everybody in the same spot.
Definitely. I think the funniest story about you turning 16 is when you turned 16, your mom showed up with car keys and a credit card. It was basically like, you're my errand boy now.
Yes, I ran a lot of errands, but I was happy to do it because I had just started driving.
Yeah. And we know intimately well, we have a 16-year-old. So while he doesn't have so many siblings, he's been pretty excited to run errands and do anything in the car for sure.
He's been very helpful.
Definitely. Let's maybe talk just about how I'll just say you're an anesthesiologist and your dad was an anesthesiologist. He's a retired anesthesiologist. So, what did you do for college and like how did that even become a thing that you were interested in anesthesia?
I think unlike probably almost everyone else on this planet, that's all I've ever wanted to do was be an anesthesiologist. When I was 6 or 7 years old, I saw my dad and saw how respected he was and that he loved his job and he worked a lot, but he was home a lot too. And I said, that's what I want to be. So going to the pediatrician at 7 or 8, when she'd ask me, what do you want to do when you grow up? I always said, I want to be an anesthesiologist like my dad. So my whole education was kind of centered around that and focused towards that. So in high school, in the summers, I got a job at the Health Sciences Center here in University of Colorado, doing research and helping out with urology because we had a friend, or actually a neighbor, who was a urologist. And then in college, I took all the classes for pre-med, all the prerequisites you had to take. But I also thought I wanted to do something different. So I did a philosophy major, like ethical studies was my major, with just taking all the classes to get into med school. I didn't want to just go the completely traditional route. And I took a few years off between undergrad and medical school. I did some really cool heart failure research that also helped point me towards cardiac anesthesia.
Yeah, because that really is your specialty. And right now, that's all you're doing for the most part
In
is
theory.
in theory. Yeah, I know. I don't know that I've known anyone that knew what they wanted to be when they were a little kid, and then that's what they've become, and that's what you'll retire doing, right?
Yeah, definitely. I always, it wasn't even just to be an anesthesiologist, it was to be an anesthesiologist and work with my dad.
Yeah.
So as I was finishing my training, there was an opportunity to take a job at the VA, which is not where my dad worked. My dad worked in private practice here in town. And
Hmm.
I thought we have the exact same name. We're going to have the exact same job. And I didn't want to just jump right into the exact same practice as him. So I took a year at the VA. And I think at first he was kind of not very happy that I made that choice because he also wanted me to be working with him too. But
Yeah.
I think it was the right thing to do. And it became clear during that year that I had to follow my heart. And I always wanted to work with my dad. So after that year at the VA, I left the VA and joined his group where he was the president and got to work with him for, I think, 8 or 9 years or so before he retired, which is pretty cool. And anesthesiologists we don't ever really work together necessarily in
Right.
our own room doing our own cases, but working with him. And I got to see him in the doctor's lounge, have coffee with him in the morning sometimes, have lunch with him. I got to
Yeah.
talk to him about stuff that was going on, about difficult cases that I had had, and he was an amazing mentor and dad, I guess. Everything
Yeah.
you could ask for, and it was everything that I hoped it would be.
Yeah, your dad is just such a great guy. He's so well loved and respected by, I think, everyone, whether it's personal or professional. So I think that was probably really cool for you to be a part of. So you're fortunate. So I think most people probably know what an anesthesiologist is, but do you want to just explain that, what your day in, day out work looks like?
Sure, I'd love to. You're right. I think people know that we exist, but not necessarily what we do. And especially patients that I talk to, they don't usually understand. So I could tell you that what I do is I see patients in the pre-op area, which is where I usually meet them for the first time, and talk to them, take their history, explain what I'm going to do for them anesthesia-wise, and then take them back to the operating room. And I'm with them the entire time they're having their procedure done, doing whatever anesthetic technique that we decided on was best for them. And then I'm with them all the way to the recovery room where I drop them off with the recovery room nurse. And there I make sure that they don't have any pain or nausea or anything like that. But it's funny, a lot of people, as part of my consent, I started telling people that I'm with you the whole time because I think people had the conception that we just take them to the operating room and leave them there and go drink coffee and read the newspaper and do whatever.
Wow.
But really, in reality, we're there the whole time, and that's where we do most of our work. That's where we're watching blood pressure either every second or every couple of minutes. We're watching how fast your heart's going, your oxygen levels, your breathing, a million different things, and making sure that everything goes okay. So we're primary care a little bit, or guardian angels, I like to say, in the operating room.
Yeah, for sure. I think if you've had a surgery, you know, because you've met your anesthesiologist, but a lot of people are probably really anxious in that pre-op area because, they've talked with their surgeon about what's going to happen. And then they know that there's probably this other person coming in, and then you are there, and it's like a pretty short little visit, and then they go back, right? We both know, and I'm sure lots of people do. There's definitely people who are just more business like I don't really want to say like not a good bedside manner, but maybe just like we need to make this happen. It's got to happen in the next 10 minutes. Let's just get it in and out. Like you said, just burst in the room kind of thing. But I know that your manner is a little different than that. Do you want to talk about that a little bit?
Sure, I think that's one of the greatest challenges of what we do. But I think it's also what I find most rewarding about what I do is because, and especially in my position where I'm doing, anesthesia for someone's heart surgery where they're having a valve replaced or part of their aorta replaced or their coronary arteries bypassed, people are super nervous. And here's this guy that they never met, and I have 5 or 10 minutes to get all the information I need, explain to them exactly what I'm going to do and what's going to happen, but also at the same time, make them feel comfortable and make them feel like they can trust their lives in my hands, which is in a way what they're doing. So, and that's the way that I approach and the way that I treat people has evolved a lot over time. But basically, I found that if you can find some common ground and make someone smile or laugh, then that goes a long way further than anything else I could do.
Yeah, for sure. We only worked together in really one capacity, right? Because we met technically in the hospital. You were in med school still. I was working as a nurse. And then we never really took care of any patient together at the same time, except for one time at Children's Hospital. You remember?
I do
I
remember
like to tell this story.
that.
Yeah, so I was working as a nurse and I was working a night shift. And I think you must have been there all day, or maybe you came in the afternoon or something, and we're covering pain at Children's. And so many anesthesiologists specialize in pain. And so, as part of your training, you have to do that. So, you understand that. And obviously, that's a big part of any surgery, too, right? And so I was coming in, and when nurses come into work, they get report. And so you find out who your patients are, and you get like a little report from the nurse who took care of them the shift before you. And so this is the day nurse giving me the report on my patient. And it was a patient, she was a teenager and had had some sort of like surgery for, I think, osteosarcoma or something like that. And so she had an epidural in, which is many people think of it with having babies, but you also use epidurals and things for pain control. And so we were sitting out in front of her room. Well, actually, first of all, in report, the nurse was like, because I was like, how's her pain? And the nurse was like, oh, that anesthesia resident is amazing. He's been up here multiple times. The mom requested that we call. He comes right up. He's so nice, all this stuff. And I was like, what does he look like? And they're like, oh, he has dark hair. And I was like, yeah, like a beard. And they're like, yeah. I'm like, that's my husband. So that was pretty fun. I know what you're like, but to see you in action and to hear about that was pretty neat. Because then later, a few hours later, you came up to check on her again. And so we were sitting outside the room. And I'm sure we're married. So the mom was kind of like, whoa, you guys know each other? And just maybe how close we were sitting together or something. I don't know. And I was like, that's my husband. She's like, oh my gosh. So that's pretty fun.
That's a good story. I like that story.
It is a great story. So, a lot of what we talk about on this podcast is it's called Harness Your Health for a reason because I really try and make it very clear. I am not against medicine in any way, shape, or form, quite the opposite of that. But I think in our culture and our society now, so many people are just suffering from these kind of things, symptoms, and conditions that medicine has a hard time putting in a box and knowing what to do with. And so people have really discovered that a lot of their own habits, wellness things that they do day in and day out can really influence their health. And so part of my mission with this podcast is helping people realize that yes, you need your doctor. You're going to have a surgery, you need a procedure, you need medications managed, whatever it is, you need that person or that provider. It's obviously very important. But a lot of the things you do, the way you eat, the way you manage your stress, your movement, like all of the things, those things matter so much for your health and to not discount them. And so you have definitely had a journey with that too. Like I think back when we first met, I don't know if you would consider yourself like a runner, but you definitely ran. Like we would go running after I would get off work, right? Or even
Yep.
when we moved to Denver, we would go running. And so I always wanted to exercise for health reasons or to be completely honest, like weight control. You know, I was always taught or learned, whether through society or whatever, that it's like calories in, calories out. You got to make sure everything balances or you're going to gain weight and all of that. So, do you want to just speak to that? Like, how has your view of health changed in the last 20 years or so?
That's a good question. I think not specifically getting into the one thing that happened, you mean just in general?
Yeah, I think just in general, when you were a resident or a med student and we would go for a run, I feel like the way we think about it is way different now than it was back then. And maybe sometimes that's also like our age, right?
Definitely. Yeah, no, I think for sure, like you said, at first, like when you're a student and when you're a resident, when you're super busy, you just kind of like everyone tells you you need to get some exercise and more like punching the clock or just to get it done. At least for me, I wasn't really trying. I didn't have any goals. I was just like, I'm gonna kind of get some exercise where I can, kind of try and squeeze it in.
Hmm.
Like you said, for whether it's for weight maintenance or just healthiness in general. At that point, I didn't really realize all the health effects that it had, like how wide-reaching the health effects were. I think I was more focused on, like you said, I sit all day in an operating room and eat probably more than I should. And so this was a way to balance all that out instead of a way to like really further my health, if that makes sense.
Yeah, that was really, I think, how the 90s and early 2000s was. There wasn't a lot of discussion about all of the health benefits of exercise. I have a degree in exercise science, so like even taking exercise physiology, those classes, like sure, it's talked about the like benefits, but I don't think any of that research or discussion really exploded until the last 20 years or so. It's really changed drastically. And so I think it's really good for people. Like, I always ask them, what is your movement habits like? Because I know, like, when our kids were really little, I didn't do a lot of really formal exercise because I was constantly running around chasing after them. Or if I was doing something, you were helping watch the kids so I could go for a run or do whatever. It doesn't always have to look like formal exercise. There are a lot of like prescriptions, if you will, for like, you want to increase your VO2 max or you want to increase your flexibility or your strength. Like you need to do these things. And that is definitely true. But they have really shown that moving your body throughout the day is one of the best things you can do. And that connects so much to your entire body and how your entire body is connected.
Yeah, I will say too that when I used to run a lot, like you said, and usually it was running on treadmills, sometimes outside, but I never really loved to run. I never would look forward to going for a run, or it was just like we said, something that we did because we were supposed to. And then when I found bike riding, that's
Mhm.
when exercise changed a lot for me. That's when like all of a sudden, after a hard day at work, I couldn't wait to go for a bike ride, or after when the kids were little and super busy, like sneaking away for a few hours for a bike ride was like so therapeutic and so freeing and so great.
Yeah.
So
I
that
mean,
kind of changed my mentality towards exercise too, finding something that I really love to do versus something that I was just doing because I thought I was supposed to.
yeah, absolutely. And even your experience with biking has been different too, right? You definitely sometimes would like, I signed up for this race or my friend's going to do it with me, so I need a ride for that or train for that. And that's really changed a lot, especially in the last couple of years. So maybe we should just dive into that and talk about that. Do you want to talk about the elephant in the room? Not really elephant in the room, I guess, but maybe I'll just summarize it. So in May, really, of 2023, you had a test done that was meant to be like a preventative test. Do you want to talk about that?
Sure, I'd love to. That's why we're here.
Yeah.
Yeah, so I had worked in private practice for a long time and been super busy and with little kids and not really taking that much care of ourselves and myself, and I think yourself as well, Karis. Like we
Mhm.
put our health as a second tier on the back burner. And so I got a new job that wasn't quite as busy. We had been like starting to think more about longevity and health and what it means and that kind of stuff, and made decisions that we're gonna like do what we can to improve our health as much as we can. And so part of it was I decided to go get a calcium scan, which is a test that they do. It's a limited little CT scan of the chest that they do to look at your coronary arteries, and it can give an idea of whether or not you have coronary disease. And I was, what, 47 at the time or something, and I wasn't really that worried that I had coronary disease, but both of my grandparents had heart attacks in their 30s. Both my grandfathers had heart attacks in their 30s, and both of them end up dying of heart-related issues much later on, luckily. But so I thought, and my dad doesn't really have any coronary disease, but I figured it'd be a good idea just to get a baseline, see how I'm doing, all that kind of stuff. And so I got that test. I think it was May 15th of 2023. And then the next day, I got a call from my primary care at the time, primary care nurse practitioner, and she said the calcium score looks great, but they found a huge mass on the CT scan. And we need to get another CT scan and try and figure out what's going on. And so my first question was like, is this common? Does this happen? Do they have incidental findings? And automatically kicked into physician mode. And it started a whole whirlwind of events yeah, that was pretty crazy.
Yeah, so I would just say, first of all, getting actually diagnosed took 3 to 4 weeks of time. And some of that was just situational because it happened to be over Memorial Day weekend. Some of that was me being in hyper stress mode. Not that I delayed it, but I thought that you had lymphoma because I'd taken care of a lot of patients with heme malignancies. And that's often how they present. They present because they pass out or they're doing some sort of exercise and they get really dizzy or whatever. And they go to the ER and they have a big mass in their chest. So I'm like, oh, you have lymphoma. I found a lymphoma specialist to take you to.
That's
So it wasn't that, but luckily they took good care of us and got you in for the biopsy, which is what you needed to get a real diagnosis. But it was so strange for me, having taken care of so many patients with cancer, that now all of a sudden it's my husband dealing with this.
And we were very lucky to have one of my very good friends is a chest surgeon. And
Yeah,
so the first thing after I found out about this and talked to Karis, the next person I called was my good friend John. And I was like, hey, John. And I didn't know if it was lymphoma or whatever. I figured it was something though, just because of how it
yeah,
looked and everything. And I said, hey, John, I think I'm going to need to be your patient here. And he was amazing. He walked us through a lot of the workup and kept making sure that we were making forward progress and kept
yeah.
things moving forward.
I
So
know.
we were so lucky to have him
Yeah,
in
for
our
sure.
corner.
Yeah, so I would say one of the things that's really made us realize is us with our expertise. I was an oncology nurse. I'm very well connected in the oncology community. I know a lot of people all over Denver. Some of those people helped to get us in to see the lymphoma specialist and things like that. Obviously, we know John and are good friends with him, but it was hard for us and for you to get the formal diagnosis. So I think one of the things that we really have realized with this situation is that it was really hard for us. I'm an oncology nurse. I know a lot of people in the oncology space. I've taken care of a lot of patients. We definitely use some of our connections to get in to see people to know what to do. And obviously with John's help too. And it took us a long, long time to get diagnosed. And so it felt like forever at the time.
Well, I
But
was thinking
also,
about that the other day. It seemed like forever, I agree, but
yeah.
at the same time, May 15th was my very first scan and June 29th was my surgery. So
Yeah,
it was only
that's
like 6 weeks total, but I agree with you because we had to fight with insurance about PET scans and the different kinds of scans and then get insurance pre-approval for surgery. And
yeah.
it felt like such a struggle at the time, but I was thinking about this just the other day. In truth, it was only 6 weeks from the
Yeah.
first scan to the surgery.
Yeah, and I guess that's just a good testament to what it feels like when you're in that moment, right? And it's so scary and you just want answers. And I just remember thinking, I don't even care what this is. We just need to know what is going on.
Yeah.
Because when you go to Google, which is what everyone does, and myself included, and you type in chest mass, there's a lot of different things that come up. And we always would tell people don't do that. But the reality is that people do that because they're searching for information, right? And
Yeah.
so you have to be careful about the information that's at your disposal and then like where you go in your mind and what you do, right? Because you can have access to the information and see all the different options, which is fine, but it's like you don't have to go there in your head and make it
Yeah.
like a catastrophe. It's something like this ha makes you stand still in a way that you almost can't even process the future. And so it's funny how that works, I think, at least for me. But then there's always points where you're looking ahead, right? We know that too, based on what's happened. So do you want to just talk about, so you had a big surgery at the end of June of that year. Do you want to just talk about that? What treatment, what the diagnosis ended up being?
Sure. I will say that the mnemonic for what a mass in your chest where mine was could
Uh-huh.
be what they call it is it's the terrible tease is how you remember because there's nothing good that is in there. So just to drive your point home of how scary it can be and not
Yeah.
knowing what's going on. So we saw through our friend, like through our very good friend John, we saw a wonderful oncologist too named Ross and met with them and they decided that surgery would be the best thing and that hopefully it would be curative. The thymus is a gland in your chest that's really active when you're young. It creates a lot of your immune system, and then it kind of just shrivels up in most people and doesn't do anything else for the rest of your life, except for some people it becomes cancer. And so there's kind of two different kinds of cancer in the thymus. There's thymic carcinoma, which is kind of the more aggressive kind, and then there's thymic carcinoid, which is the very rare kind that I ended up having that usually isn't quite as aggressive. But we knew that from a biopsy that I had gotten. So the hope was surgery would be curative. We do. My friend John, luckily, was also probably the best lung slash chest surgeon, certainly in the state, if not in the country. So we're lucky enough to have him advocating for us and doing my surgery. And had a thymectomy where they went through my chest. They used a robot so that they didn't have to make a big sternotomy and cut my whole chest open to open it up. They were able to go through a much smaller incision with an easier recovery. And I think it was not an easy surgery for John. At least he tells it that it's not. And there's been many beers bought as a thank you to him, but he did a wonderful job. And, I probably could have gone home that night. They kept me overnight. I had a chest tube and I had a wonderful anesthesia team too. Luckily, it was one of my residents was the anesthesiologist. I handpicked him too, along with John's guidance. And he did a wonderful nerve block for me. Surgery went really well. I spent one night in the hospital, went home the next day. And I think I took 2 total pain pills the whole time. And then the rest of the time, my pain was under control with Tylenol and Advil. Super lucky in
Incredible.
that regard.
Definitely. Maybe we should just back up too and say, obviously, when you know someone who has these skills and can do this surgery, that's like we talk about in the medicine world. Sometimes, like people will operate on their spouses, or people will take care of their spouses or their kids or whatever. And I feel like everyone's line in the sand is a little bit different with that. You talked to John and were very upfront about, hey, I get it if this is not something you want to do because we are good friends. But I'm sure he gave it some thought knowing him, right? And he was like, no, this is something that I want to do and I can handle it.
Yeah, there's nothing more stressful than taking care of someone that someone that asks you to take care of them.
Yeah.
And then with cancer too, it's even worse, I'm sure, because it's, what if you don't get it all out or where he's working, there's a lot of stuff that could be damaged. There's a lot of bad things that can happen doing
Yeah.
surgery like that. And when it's your patient, it's different than when it's your friend who you ride bikes with and go to concerts with and have dinner with and stuff. It's so
Yeah.
yeah, I was very cognizant of that. And I told him I was hoping that he wouldn't say no because he's the best and he's who I wanted. But at the same time, I don't want to paint him into a corner where he
Yeah.
feels like he has to do it. So luckily, he
Of
was
course.
very gracious and I'm sure he was super nervous.
Well, when he came to meet with us, me and your mom and dad in the room. So, when you have a surgery, there's like a little room off the waiting area where the family is waiting, and some staff member will come in and talk to the family once the patient is done with the surgery and they're finishing things before they send him to the recovery area. And he laid his head down on the table. And I know he only did that because it was me and your mom and dad. But it showed, he was like, that was really tough. He was just expressing the relief, I think, of that it went well, but that it was really hard. And then, of course, he had to make a joke about how part of the tumor was up against your lung. And so he had to take out part of your lung, and so that he'll be faster than you on his bike from now on.
Which he is.
That was his way of lightening the mood after like a serious conversation too. But I think everybody has had healthcare people take care of them in some capacity where they really needed it. They needed that expertise. And I think we're always grateful. But when it's something so serious like this, I think I was just so appreciative of every single person and their job. I just remember being there in the pre-op area and the PACU area and thinking about these different people who are working here, what they're doing and how they're taking care of people. And I don't think people really realize, I didn't even realize when I was working as a nurse, I don't think like how important that work is and that how much it can really affect you. I know you get attached to people sometimes.
Yeah, absolutely.
Yeah.
That's what I get to.
That's the humanness part of it, right? And in oncology, that's very often what happens is we give someone their treatment over and over and over again to get to know them, you get to know their family, their daughter's in town, whatever. And it's just like trying to make that experience the best you can be, just like you described in your pre-op. The way that you approach it is you have 5 or 10 minutes to help someone to ratchet down a couple notches, right?
Yeah.
It's really, really important. So I just want to give a big shout out to all the healthcare workers because every person's job is so important and it really does make a difference for how people get through these really serious, very stressful Thanks. So you had a surgery then, and then, as often happens when you are diagnosed with cancer, you go on a surveillance process, or you have some other treatments. Some people have surgery first, and then they have chemo or radiation. But we were basically on the watch and wait, getting scans every so often. Do you want to just talk about that a little bit? Just the following year or so, like what progressed after that?
Oh yeah. So when I had my initial, like the first CT scan, not the one for the coronaries, but the other one, there was also two lymph nodes that were enlarged as well. When they did the surgery to take my thymus out, they took out one of the lymph nodes, not the other one. And so when I got my first scan, which was like I think right after the first of the year, so about 6 months after surgery, the lymph node was still there, which led to a PET scan, and it showed that it was cancer too. So led to another surgery with John helping out with another surgeon whose specialty was doing stuff around because it was a little bit higher up in the neck. So with that guy who does specializes with surgery in the neck. So the two of them took out that lymph node too. So I
Yeah.
think that was in May as well. That was like early May though, because they wanted to do it on Jackson's birthday, but we said no.
That's right.
Yeah. So that was like almost a year later. We ended up taking that out.
Yeah. And so then back on the surveillance, having scans, and you mentioned that your cancer was more of a slow growing cancer. The thing with pathology is when they take tumors out and they're looking at them, sometimes it's straightforward and sometimes it's not. The other thing that we did in this process is we went to the Mayo Clinic. So I'll just mention here, when you're doing research and looking for things, the internet is wonderful and it can connect you with people. And we found this guy named Mike Delaney who had had thymic carcinoma, and he had pretty extensive disease, or a lot more extensive than you had, because most people who are diagnosed with this cancer it doesn't get discovered until they have other symptoms or some kind of major thing happens. And so Mike had started this group called the Thymic Carcinoma, I think it's Society or something. And basically it has a Facebook page, and just reached out to him. And I was just like, hey, my husband just got diagnosed with this. I don't know what exactly you do, but we're just lost. I've taken care of cancer patients for a long time. I've never heard of this, or maybe one person. And so he was amazing and is really doing a lot of work to raise money for further research, because that's one of the hardest things about this kind of rare form of cancer is there aren't really established treatments. And people don't often think about that. They think it sucks to get diagnosed with cancer no matter what cancer it is. But at least if you have HER2 positive breast cancer, there's an entire treatment strategy for that, right? Based on your staging and all the things. And so for your cancer, there wasn't a lot of information. There was not a lot of specialists, definitely not in Denver. Our oncologist was great and your team was great at university, but we went to the Mayo Clinic. Do you want to just talk about that? Which a lot of people do for specialty things or second opinions. And that was at the advice of Mike. He suggested that we get a second opinion and talk to someone who has seen more of these cases, seen more of the treatments, and just so that we can understand things a little bit better.
Yeah, Mayo is it's a very spectacular place. It's like a little city in and of itself. We were lucky enough to see one of the experts in the field. I think there, Dr. Mansfield was awesome too. We were blessed from beginning to end to have so many wonderful doctors and stuff. And so we got to go, met with him. And I think the problem was like when they took that second lymph node out, they weren't sure if it had grown through the lymph node into the surrounding tissues or if it
Mhm.
was contained, and which makes a big difference for treatment. And it's not always as black and white as it seems like it should be,
Yeah.
especially for the more kind of weird, rare cancers like I had. And so
Mhm.
Mayo looked at all the scans, they actually got the pathology, they got the slides and everything and looked at it themselves. And he thought that it looked like it was all contained and just continued surveillance. And
Yeah, and
so,
he
yeah.
was wonderful. They spent hours with us, right? Obviously, we traveled up there, but that was really, in my mind, just so helpful to talk to someone who is like, no, I've seen this before. This is what we see. And obviously, it's not always cut and dry, it's not black and white. But having him, and you could go back and see him again if you needed, right? Hopefully, we'll never need to do that, but it's just so nice knowing that you have these people.
For me too, I think that was like one of the scariest moments too, because like you hear about people that are going to these huge regional centers as a first, second opinion for cancer, and you never think it'll be you. You
Yeah.
hope it'll never be you. And you think that if I do get something, hopefully it'll be straightforward and easy. And here I was flying to Rochester, Minnesota to like see a specialist for some crazy thing that I didn't really know what was going on.
And you have a strong family history of prostate cancer too. And so we always had that on our radar. Like, when should you start your prostate surveillance, like the blood test and all of that? So this was like not on the radar at all, which
No,
is how things happen sometimes.
yeah, that's how they happen a lot of times.
I would say the first year or so of dealing with all of this, going through the surveillance, having the scans, scan anxiety is a true thing. People talk about it being anxious, and it makes sense before you have a scan. I mean, we will both attest that that is a real thing. I think we definitely had some good health practices in place. Obviously, I've had my practice going for a long time, but there's something about a huge stressor that kind of, in some ways, makes things fall apart, and in other ways, brings it all back together, too. So I think the way I look at it is you had this big chest surgery. You couldn't get in water for 6 weeks, right? You couldn't get
Mhm.
in the pool, in the hot tub, none of that, which is a bummer because that's therapeutic, right? And it was summer, too.
We're going on a beach vacation.
Or the ocean. You couldn't get in the ocean, right? So that's just a bummer. I think there was just definitely things that just make it like it's not the end of the world, but it's also this really sucks. And you couldn't really ride your bike the way you wanted to. I still remember when you went on your first bike ride, and
Mhm.
it wasn't against doctor's advice, but I think the advice was like, take it easy. Don't go anywhere crazy, no riding up North Table Mountain or whatever. And I don't remember exactly what you did. I just remember that I got a text from John, your surgeon, when he saw it pop up on Strava that you had gone for a bike ride.
I think I titled it "Sorry, John" or something like that.
But you needed that. You that at that point, biking was such a huge part of your life. You had been doing it for so long, and it was very therapeutic in nature. But I think that it's really changed for you in the last couple of years, like biking in particular. And I think also when you get to the age that we are, you do start thinking about longevity. You already mentioned that. But do you want to just speak to like how your health habits have changed in your mind? Your health habits are not really that different than they were before. I mean, in some ways they are, but I think the way you look at them has definitely changed.
Yeah, I would agree 100%. First of all, I think I want to take it just a step back and say, especially for the riding my bike thing, when you get diagnosed with something like cancer, well, I've been thinking about a lot, obviously, and when you have surgeries and procedures, I totally understand now, like, why people are so anxious to get back to their life because it's your way of saying everything's fine, everything's going to be okay. So the sooner I could go back to work, I think I only missed a week of work plus 3 days for when I had my huge chest surgery. I only
Mhm.
missed a week of work when I had my other surgery. And the quicker you can go back to your normal life, the quicker you're telling fate, hey, I'm going to be okay. Everything's going to be fine. And that's part of the reason I wanted to ride my bike sooner too, just to say, hey, everything's going to be okay. I'm going to survive this. It's going to
Yeah.
be great. But and as for health habits, I think it became more formalized for me after this. Before I had an idea of what I wanted, or I'd been training for certain rides or whatever. I always needed that pressure of training for something or that like that motivation of training for something to get out there and exercise a lot. It was more piecemeal after going through this and realizing how things could change or how things were going to be different. It became just a more formalized thing where now I sit down every month and make a calendar and I try and lift twice every week. Or I do lift twice every week. That's the goal. Meditate every day. Since the beginning of the year, I've been doing yoga almost every day, not every day. I put it on the calendar with my call schedule and my work schedule just to make sure I have time to get all the things done that I need to do. And so it's not totally written in stone because my job's very fluid. And so there has to be some fluidity to it. But at least I know that I'm going to have everything scheduled I want to do that week. And so if I can move stuff around within that week, I can get it all done. All the things I need to do. We also started doing cold plunge and sauna. We remodeled our bathroom and put a cold plunge and a sauna in there. We
Yeah.
made a lot of decisions that were like, we're going to be more health centered going forward. We're going to make that a priority.
Yeah. And in a holistic way, I feel like there's so many things you can do. You can stick with a rigid schedule, but if you're just really feeling trash from the week, or you've been on call, you've been up all night doing a case or whatever, you might not be able to do the 50-mile bike ride the next day that you had planned. So it's also reminding yourself that you're going to do something, right? Because what I remember before, like 10 or so years ago, is if you were up all night and you just wouldn't do the ride at all, right? It would just be like, I can't do that, so I'm not doing anything. And now I think you just have this beautiful way of, yeah, I'm super tired, but I'm going to go for a bike ride with my son, or I'm going to do yoga, or I'm going to get in the sauna, right?
Yeah, do an e-bike ride.
Yeah, exactly. And so it's definitely the mentality of that has changed rather than black and white. It's made it more fluid. And I think you feel more control of that. And so when you look back at the month, there might be days that totally fell apart because of your schedule and your life, the way that it is from that standpoint. But you still, if you look at the whole month, you're like, I did all of these things. And that's why I love your calendar. It's literally just a piece of paper with a bunch of check marks.
Yeah, it's as low tech as it gets. It's from being an intern, you learn how when you have tasks to do, you put a little check box and write the task out. And when you check that, you do check it off when you do it.
Yeah.
And it makes you feel like you accomplished something.
Yeah, it's whatever system works for you, right? Everybody's system has to be a little bit different, but you start a system, you use it consistently, and then you decide, is this what works for me? And this is just your system.
I
And
think the other great thing that I did is I schedule rest days now too. I
oh,
don't feel guilty if I have, even if it's a weekend, if it's scheduled as a rest day, even if I have time to do some like a big bike ride or something, I don't feel guilty about taking a rest day.
yeah, that is
It's super
huge.
important.
For sure. And a lot of people I see just push through and they're just super depleted and not feeling very good. And the rest day is almost like the swear word. It's like you don't even
Mhm.
bring it up. It's like the same category as taking away their wine, their coffee, or their rest day, implementing a rest day. So
Yeah.
I love that you brought that up. That's definitely a good point. So, what do you feel like moving forward because you have a scan coming up in a few weeks? I mean, you've been meditating for a long time. You've been meditating even prior to when this happened. I don't even remember when you started meditating. When did that start?
I don't know. It's been a long time ago. I
Yeah.
think it certainly was nice to have when I was going through, especially the initial stages when I
Yeah.
wasn't sure how things were going to go. I wasn't sure how serious this was going to end up being or what
Yeah.
was going to happen. It was very helpful then.
Yeah. I guess we left out the radiation. So you had the second surgery in May of 24, and then of spring of 25, they went in with the radiation to go after that lymph node, a couple lymph nodes,
Just one.
just one that you had in your chest. You've definitely had this kind of path of like surveillance and some treatment. And I think it can feel, at least for me, I just describe it as a roller coaster. It's like you get the treatment done, you're feeling good, and you're on this high, and you ride that for a little while, and then the scan is coming or whatever the next thing is. And so then you get anxious, like coming towards that. That happens, whatever happens with that, then you like, okay, now this is what you need to do. Or I think one of the best things was it in September of last year when you had something that was on your scan that had been there for a while but hadn't grown. And you were like, hey, can we push this out a little bit? Like
Hmm.
you advocated for that,
Yep.
right? Like, how
Yeah.
did that make you feel? Because I think what I would say from taking care of cancer patients is the common thread is that people feel out of control. They feel like they don't have control over this, whatever's happening, and they have to do this treatment, or they don't ever have to. It's always your choice, but like it's recommended and it derails their life, it derails their plans. And I think that's the hardest thing for people. And one of the reasons I think that like harnessing your health and taking control in the way that you can is helpful. But what would you say?
No, I agree 100%. I think by the very nature of this, when this something like this happens, you're completely out of control.
Yeah.
And you can do little things to try and control it, but in the end of the day, you have zero control. And I definitely still have a lot of anxiety before scans. I'm starting to feel the scan anxiety
Mm.
now. And in the past, definitely before all this stuff happened, but at the beginning of this too, like the way that I would deal with anxiety is by not taking care of myself, by eating comfort food, sitting around, doing nothing, not exercising, just kind of being, and I wouldn't say depressed, but just not doing anything. And so I've been trying to change that now when I feel that feeling, instead of eating a bag of chips, I've been trying to go exercise or get in the sauna or do something that's more beneficial.
Yeah. And it sounds silly, like your that singular sauna session isn't going to take control over the situation. The way it is taking control is because you made the decision to do that. And that's a different, healthier decision than sitting on the couch watching TV or eating the chips or whatever.
Yep, exactly. Or even going for an easy bike ride or taking our dog for a walk. It's like
Yeah.
it's at least doing something positive instead of just sitting there waiting for whatever is going to happen to
Right.
happen. Because
Yeah.
whatever is going to happen is going to happen no matter what I do. So
Right.
I can either be in the best shape that I can for it and be ready to meet it or celebrate hopefully nothing
Yeah.
more needed to be done, or you can just get sit on the couch and waste away. And I've
Yeah.
decided that's not how I want to be. I want to be proactive and healthy in 10 years when this is all way behind us. And I'm going to be grateful for this time that I used it to springboard to being a better person and better health
Yeah.
and I would say not even just the health wise stuff, but I feel like family wise too. I feel like,
Mhm.
before I worked a lot and I was tired. And when I was home, sometimes I was on the phone talking about work or, in our room watching TV on my phone, things like that. And I feel like this has just made me so much more appreciative of the
Mm.
time that I have. And I feel like I'm more present and with doing stuff with the family more, being
Yeah,
around more than I was before, which
for sure.
I'm not sure that it would have happened at some point probably, but I don't know if it would happen as drastically as it did without
Yeah.
all this stuff going on.
Yeah, you've definitely voiced that that is something that was like really in your mind and noticeable. And I think a little bit too because of the age of our kids, or the age our kids were at when this happened, and they were a little more independent and obviously a lot more independent now. They're 15 and 16. And so you see them becoming more independent and less time with them. And so it also makes you, at least it does for me. I'm just like, oh, this conversation that I have with them in the kitchen is my way to interact with them today.
Absolutely. And I think not to get too heavy, but like when you look at your own mortality and thinking about maybe I only have a couple years left and you think about what's my legacy going to be? Like, how are my kids going to remember me? How is my wife going to remember me? I don't want them to be like, yeah, he worked a lot and then he came home and sat on his phone in his room, or he worked a lot and then he came home and just went for a bike ride and didn't really interact, or like I didn't want that to be my legacy either.
Yeah, for
So
sure.
hopefully I
Yeah,
have more than just a few years, but I feel
yeah,
like things are way different than they were. We're coming up on 3 years. I guess we just hit 3 years.
yeah,
We're past 3 years now, just past 3 years since all this stuff happened. And as much hardness and heartache and stuff as it's been, it's also, I think we've used it as a positive thing, like
yeah.
to improve ourselves, improve our health, improve our relationships, improve our lives.
Yeah, absolutely. I would agree with that wholeheartedly. Is there anything else you want to say, or do you feel like what if someone listening to this has received a scary diagnosis or has been going through something like this, kind of a roller coaster? What would you say to them?
I would say that it's super scary and it's advice that I got a lot too. And sometimes it's hard, sometimes it's easy, but every day is a gift and you need to treat every day like a gift. And that's true whether you've had a scary diagnosis or not, because we're all one doctor's trip away from a scary diagnosis. I was having no symptoms. I had no idea that anything was going on with me at all. And I
Yeah.
went in and got this life-changing event. So I think especially if you have a diagnosis, and our oncologist, his advice or his philosophy was like, if you have 90 days between scans, then do something for 90 days, make those 90 days, do something you never would have done, take guitar lessons or learn to sing or, run a half marathon or a 10K or a 5K. Use the time that you have left because, especially if it's a limited amount of time that you have left, you don't want to waste any second of it, which it's hard. It's easier said than done. And certainly sometimes I do it better than other times, but really, truly just treat every day as a gift to be grateful for every moment that you have,
Yeah,
even
100%.
even the ones that aren't so great at the time.
That's true. Sometimes you do have those, we all have those days, right? And that's the beauty of a day is that the day's over and you get a fresh new day the next day. There's always little silver linings. Our boys are really funny and you're really funny. So we have a lot of laughs about different things. And I think laughter, it's very therapeutic.
Definitely. When I think about the things that we've done in the last 3 years, we were talking about this the other night. We've done a lot of really cool things
Yeah,
in the last 3 years that maybe
truths.
we would have done or maybe not, but we did them. So that's what counts.
Yeah, experiences for sure. Yeah, we have done like a Christmas trip where we give our kids a trip for Christmas instead of buying them presents. They still get some presents, but it was started as less materialism and less stuff. And the joke about the trip is way more expensive than the stuff would cost.
A lot.
But they have been talking about this. We've been doing this for probably at least 10 years, right? Maybe
I
even
think
longer.
so.
And
Yeah.
so the kids always talk about the trip. They love the trip, they remember the trips. So we've started doing this even more. Our 16-year-old, when he turned 16, we went on a trip, right?
Yeah.
For Jackson's birthday, we got him an experience instead of buying him another device or another whatever.
Yeah.
We've really tried to lean into that too. And I think that that has been such a good example for them to remember that those material things don't matter and that experiences, you always have those memories. And like you said, we never know like how long any of us have. And so having those experiences and those memories is something that you can't, no one can take that away from you. It's always going to be there.
Yeah, that's what it's all about.
Yeah, for sure. Well, thank you so much for being here. Obviously, this is a special interest episode, but definitely one we wanted to put out there. And obviously, you're a very special guest to me. So thank you for being here and sharing all of that. I know it's not easy to always talk about that stuff and all these serious things, but I think that's also very therapeutic too.
Yeah, absolutely. I appreciate you having me on.
Of course. All right. Have a good day, everyone. What I hope you take away from this conversation is that taking care of your health doesn't require a diagnosis to get started, but sometimes it takes one to finally make it non-negotiable. Jimmy's story is a reminder that we are all, as he puts it, one doctor's visit away from life-changing news, and the way we live in between those moments matters deeply. This is exactly why I talk about the foundations on this podcast. Movement, rest, nervous system regulation, and mindset are all a part of this. Not because they guarantee a perfect outcome, but because they keep you in the driver's seat of your own life, even when so much feels out of control. There's no guest link or resource to share today, just an invitation. If this episode resonated with you, if you're in a season of uncertainty, or if you've been putting your health on the back burner, I'd encourage you to take my Health Foundations assessment. It's the great first step to understanding where to focus your energy. You'll find the link in the show notes. And if this episode meant something to you, please share it with someone who needs to hear it. These are the conversations that remind us what really matters. As always, your body isn't broken. It just needs the right support in the right order. And sometimes it just needs you to show up for it. See you next time. The information shared on this podcast is for educational and informational purposes only and should not be considered medical advice. I am not a medical doctor, and this content is not intended to diagnose, treat, cure, or prevent any disease. Please consult with a qualified healthcare professional before making any decisions related to your health, especially if you have a medical condition or are taking medications.